So we've got chapter 17, neurologic emergencies. Stroke is the fifth leading cause of death and then the absolute leading cause of adult disability in the US, and this is according to the American Stroke Association. Stroke is very, very common in geriatric patients, and there's several contributing factors that lead somebody to have a stroke. It includes family history. Those of different races tend to have higher stroke risk. African Americans, Hispanics, and Asians are the ones that really are more at risk. There are treatments that are available for stroke. Many hospitals now, the larger hospitals, are certified stroke centers, but in order for them to receive these treatments, rapid transport is essential. We can't do a whole lot in the field for somebody that's experiencing stroke. Seizure and also mental status may occur when there's other disorders with the brain outside of stroke themselves. Seizures may occur because of a recent or prior head injury, a brain tumor, metabolic problems. Fevers can also cause strokes, and then genetic predisposition, some people just have seizures and we don't really know why. Altered mental status is a common complaint for our patients, and they may not say, I'm altered, but they present as altered. And there's several different reasons that they present with an altered mental status: intoxication, head injury, hypoxia, when your brain doesn't get the oxygen that it needs. Really weird things can start happening. Our body sends a large percentage of the oxygen that we take in and the glucose that we take in up to our brain because it uses so much of it. The metabolic rate in the brain is ridiculously high. So metabolic disturbances definitely affect the brain. Anatomy and physiology of the brain itself. We already did go over this a little bit. So the brain itself, it's basically the body's computer. It controls all of your physiologic functions. The brain has three major parts. It can be broken down much further, but we'll just go with that for the purposes of this class. The cerebrum is the largest part. Let me get over here to this picture. Cerebrum is the largest part. The brainstem is where most of your control centers lie. So those that control your breathing, your blood pressure, pupil constriction, basically all those things that keep you alive, mostly tend to reside right there in that brainstem. And then the cerebellum there in the back, controls muscle and body coordination. So when you walk, when you play the piano, when you just even bend down to pick up a coin, those things that just involve a lot of moving parts that we don't really have to think about. That's all that cerebellum taken care of for you. The cerebrum, located above the cerebellum, is further divided into left and right hemispheres and control the opposite side of the body. So that right hemisphere actually controls the left side of the body. The left hemisphere controls the right side of the body. The frontal portion of the cerebrum controls your emotion and your thought. The middle part controls sensations and movement. And then the back portion processes sight. You have messages that travel to and from the brain that help you interpret your world and then react to that world. So you've got 12 pairs of cranial nerves. You have one that comes out on either side, so a left and a right. And then you have spinal nerves as well. Here's a representation of all of that. Your spinal cord runs from the base of your brain at the foramen magnum, so that big hole at the bottom of your skull, all the way down. It actually terminates um, well before your vertebral column does. You can kind of see where the bulky portion of the spinal cord ends, and then it ends up branching out into all these other nerves. This is called the cauda equina, literally translated to horse's tail. Um, but you have um, a spinal nerve that comes out of each of your vertebrae. Again, one on the left, one on the right to form a pair. And they receive signals from your body and then carry other signals out to your body. Okay. All right. You have a lot of different disorders that can actually cause brain dysfunction. This typically is going to affect the patient's level of consciousness, their speech, and then voluntary muscle control. The brain, like I said just a few minutes ago, is extremely sensitive to changes in oxygen, glucose, and then temperature as well. General rule, if the problem is caused by a disorder in the heart and the lungs, the entirety of the brain will be affected. If the primary problem is in the brain itself, typically only a portion of the brain is going to be affected. So the one that houses the problem. Some common neurologic complaints: headache. You will hear headache from your patients a lot. It can be a accompanying symptom from another condition, or that may honestly be the reason that you're called. Headaches can get pretty severe sometimes. The majority of the headaches that you will encounter are not caused by anything severe. There, a small portion of them, yes, are, but it's really hard to tell the difference. Different types of headaches. Tension headaches are really super common. Other ones, sinus headaches, migraines, those are pretty common as far as headaches go. Tension headaches themselves are caused by muscle contractions in the head and neck, often attributed to stress, and they tend not to be life-threatening. Really, your pain is described as squeezing, dull, or as kind of an ache. Usually don't require medical attention. Our society, we tend to do a lot of work on computers, and we pull our shoulders up toward our ears, and those muscles end up getting very fatigued. So the best way to work on preventing tension headaches is to literally remind yourself to relax those shoulders and let them drop down into a natural position. Migraines are a little bit different. So they're thought to be caused by changes in blood vessel size in the brain, but truly there is no definitive yes, this is what causes migraines. Both adults and children can experience migraines. Women are 3 times more likely to experience migraines than men are. The pain is usually described as pounding, throbbing, pulsating. I can feel my pulse in my head. Migraines often have accompanying symptoms, nausea and vomiting, and may be preceded with warning signs, which are called auras. Can be like flashing lights, visual changes, partial loss, and people that have frequent migraines tend to get a notification, if you will, from their body that something's coming. Migraine headaches can last for several hours or for several days, depending on the person, really. Sinus headaches, it's caused by pressure that results because fluid builds up in the sinuses in your head. Remember, those sinuses are the areas of the bone that are more so hollow. They allow for resonance of voice. They allow for lightening of the skull itself. So you have membranes that line those sinuses. They're not just empty holes. So when those get inflamed, that causes the congestion or the pressure that you feel. You also tend to have cold-like symptoms that go along with that, some cough, maybe some fever, depending on what's going on. People that have allergies just have repeated inflammation there. Most of the time, not going to be required any medical treatment. Serious conditions that have headaches, some of those red flags that's like, yeah, something is not right here. The table is up there for you to review. If patients have a severe headache, seizure, altered mental status, then we start looking into more serious conditions such as stroke. Any sign of increased intracranial pressure that includes a headache with vomiting, altered mental status, and seizure is definitely something we want to investigate further. Increasing intracranial pressure could be a sign of a hemorrhagic stroke, tumor, or a recent head trauma. Your patient assessment should include asking the patient if they have experienced any recent trauma. Just because they are seated comfortably on their couch doesn't mean they didn't experience something prior to your arrival. Stroke is also called a cerebrovascular accident, or a CVA. It's caused by an interruption in blood flow to an area in the brain that ends up resulting in the loss of brain function. When your brain cells lack oxygen, they stop functioning appropriately, which can cause that altered mental status, but then they also start to die. Once brain cells die, there's really not much that can be done. So some of the newer commercials now that are talking about stroke say time is brain. The longer that you don't have adequate oxygenation to the brain, the more brain cells that are going to die. Brain cells can develop ischemia because of a lack of blood supply, or because what blood supply it does have has inadequate oxygen levels. While you may have ischemia taking, it can take longer for the cells to actually die, because you may have small little trickles of blood that are keeping the cells from dying, but they're still not functioning. If we can get that patient in and treat them very quickly, the cells end up not dying and they can return to normal function. Sometimes it takes a little while for that to be restored, but they can make a miraculous turnaround. However, that does require prompt treatment. We don't delay transport on somebody that we believe is having a stroke. We'll go ahead and stop here and continue on in the next video.